Hello, I'm Dr. Ashmina Khalsa. I'm the Senior Consultant Obstetrician Gynecologist at Cloudnine Hospital, Lucknow Division. Teenage years are some of the most important years in a girl's life. It is a time when you've started your period at menarche and you go on. A lot of us have seen young girls who come back with extremely painful period cramps, and mostly this would be seen in the first 2 to 3 years from the onset of menarche, that is your first period. At a time like this, it is advised that the mother assists her daughter to be brought up for a checkup to the obstetrician, as there can be certain conditions, pathological conditions, such as a small cyst. It can be endometriosis, it can be an ovarian form of a cyst, a benign cyst, like a dermoid, like a small mucinous, like a hemorrhagic cyst, a follicular cyst, which probably has not ruptured or has ruptured and now causing pain. These conditions can all be diagnosed by a simple pelvic ultrasound scan. Now, once this condition has been diagnosed, a pathological condition in such a young girl, they can always be managed according to the size of the lesion. It can be managed either, with medications like analgesics, by cyclic hormone therapy, or by just changing the routine lifestyle of the girl. But however, certain cystic pathological conditions such as the dermoid, such as the mucinous, may require a small simple laparoscopic procedure to be done where these cysts are removed, as later on they can cause complications of rupture, complications of torsion, or complications of just, involvement the entire ovary and infertility later on if left untreated. There are certain other conditions where we normally perform an ultrasound and we don't find anything. However, the young girl continues to have severe cramping pain. This condition gets to be known as primary dysmenorrhea. Largely, when we see a girl of primary dysmenorrhea, I realize that actually there is no pathology. But if you go on to taking family history, she would probably say her mum, her sisters, also giving a similar set of symptoms in their early years of onset of periods. In such girls, it is important to reassure them that there is no pathology, to ensure that they are having no pain. A certain use of analgesics is important. These girls can also be advised sometimes with cyclical hormone therapy. Now, there are certain home remedies in the form of hot fomentation, hot bags, heating pads, which will also help us elevate this pain to a certain level wherein the girl is relieved to some time. If a girl is telling us that the pain is so severe that she is not able to perform her routine activity like going to school, going for her regular activities, performing even simple tasks like walking up to the washroom, or she's having pain on urination, defecation, please don't ignore these symptoms. Please come back to ask for a checkup for them. These are definitely the girls who require medical therapy in the form of analgesics and other drugs. So a painful period in a teenager must always be evaluated and must not left unattended. Thank you.